So, family history is very prominent in heart disease. So when family histories, patients can do everything right and still develop heart disease. We don't really see that in peripheral artery disease as much. Really, it's more risk factor driven. It's really driven by smoking. That's probably your number one overall risk factor that's modifiable, and uncontrolled diabetes. So we don't tend to see if you have a family member who had peripheral artery disease and was an extensive smoker and you're not, we don't tend to see patients. You probably will not develop it. So it's definitely a modifiable disease. But if you talk about peripheral artery disease as something that you have, it carries a worse prognosis than breast cancer, because what it's telling you that the blood vessels of your legs and maybe your arms are extremely unhealthy, and your risk of heart attack and stroke are tremendously high, and your overall mortality is worse than having breast cancer. So it is a very sinister disease that once you find it, you got to really be aggressive and treat it aggressively, because it's telling you that bad things are about to happen to you. And about 10% of people over 55 have peripheral artery disease.
Wow.
It's probably higher here in the state of Mississippi because our risk factors are so high, right? Our diabetes rates are so high, our blood pressure rates are high, our cholesterol rates are high. Smoking is tremendous down here, and all that adds up to a lot of death and stroke and complications and loss of limb in the state.